Okay, so buckle up, because today's deep dive is going to be a little unsettling.
Yeah, this one's a bit heavy.
We're talking about risk assessment, specifically in healthcare, and how it was handled, or maybe mishandled is a better word, during the peak of COVID-19 in the UK.
And we're talking about the potential consequences for healthcare workers who are, already on the front lines.
Exactly. And what's really concerning is that this isn't just some armchair speculation. This is coming from a veteran health and safety expert who's been in the field for 3 decades.
30 years. He's seen it all.
Right. David Osborn, a chartered occupational safety and health practitioner. He wrote this blog post that we're dissecting today, and he does not hold back. He calls what happened in the UK the biggest abuse of the health and safety system in living memory.
That's a strong statement.
It is, but it really makes you stop and think, right?
It does.
So before we go down this rabbit hole, let's just do a quick level set, because everyone hears risk assessment.
Mm-hmm.
And it might sound kind of technical, but we actually do this all the time in our everyday lives.
Oh, absolutely. Like crossing the street. That's all risk assessment.
That's right.
Are you looking both ways? Is there a car coming? How fast are they going?
Exactly. Even something as simple as that. You're constantly weighing the potential risks and making decisions based on those calculations.
Exactly. And to put it in official terms, risk assessment is really just identifying hazards, figuring out how likely they are to cause harm.
Right.
And what those consequences might actually look like. But then the really crucial part is figuring out what you can do to actually reduce those risks.
So the control measures.
Exactly. You got it.
Okay.
And this is where things get really interesting, or should I say concerning, with how risk was managed in healthcare settings during COVID. Because for a risk assessment to actually work, to be effective, you need to have a really good understanding of the actual hazard you're dealing with.
Okay. So in this case, the hazard being COVID-19.
Yeah.
But early on, we didn't really know much about how it spread, did we?
Exactly.
At all.
That's exactly the point Osborn is making. Remember all the talk about washing your groceries and wiping down packages with Clorox wipes?
Oh, yeah. I was practically bathing in hand sanitizer back then.
We were so focused on surfaces thinking it was mainly a touch-based thing.
Right.
But as we learned more, it became really clear that COVID-19 was primarily airborne.
Which completely changes how you have to assess the risk, right? And what measures you put in place to mitigate that risk. Because you're not worried about, wiping down your mail if someone across the room could be breathing on you. I got to talk about mixed messages, right? We're over here sterilizing our produce while potentially breathing in, a cloud of COVID.
Yeah, it really highlights just how crucial it is to have accurate information when you're making these risk assessments.
Absolutely. But here's the real kicker. Even when it became clear that COVID was airborne, Osborn argues that this knowledge didn't actually translate into how risk was being managed in hospitals.
Right, where the stakes are even higher.
Exactly, where the stakes are incredibly high. And he points to a specific group, this group that was responsible for, guiding these hospitals on safety protocols.
Yeah, the Infection Prevention and Control Cell.
The IPC Cell.
Okay, or IPC Cell for short.
So they're the ones, coming up with the guidelines, saying this is what you need to be doing to stay safe.
Exactly.
But Osborn's point is that these folks, the IPC Cell, weren't actually experts in workplace safety.
That's his argument.
So we're talking about the people making decisions about healthcare worker safety during a pandemic.
A novel, never-before-seen pandemic.
And they didn't necessarily have a background in, keeping people safe at work.
That's what Osborn claims, yeah. He says that the IPC Cell was mostly made up of, infection control professionals, which, makes sense on the surface, right?
Sure.
But there were very few, if any, occupational safety specialists involved.
Okay, so to be clear, I'm no expert, but that seems like a pretty big oversight.
It's like asking a pastry chef to, design a suspension bridge.
Right.
They're both skilled professions, but they require very different skill sets.
Exactly.
And so it seems like there's this gap.
Totally.
And this actually gets to the core of Osborn's critique, which is that there was this lack of understanding of this really crucial principle in workplace safety called the hierarchy of controls.
Okay, hierarchy of controls. That sounds a little intense. What is that?
It sounds more complicated than it is. Basically, imagine a pyramid, right?
Right.
At the top of the pyramid are the least effective ways to manage risk. And as you go down the pyramid, each level represents a more reliable method of protection.
So, if we're talking about, let's say, avoiding mosquito bites.
Yeah.
The least effective would be just I hope I don't get bitten.
Right. Exactly.
And then more effective would be wearing Bug spray.
Exactly.
Even more effective, maybe sleeping under a net.
Yes.
And then the most effective would be like, don't go outside, I guess. Or like, avoid mosquito-infested areas altogether.
Exactly. Like, eliminate the hazard completely.
Right.
So you're not just relying on one thing. You're implementing multiple layers of protection, and you're prioritizing the most effective ones.
Gotcha. So how does this hierarchy of controls apply to what was happening in the UK hospitals?
So Osborn argues that the IPC Cell, the people who are supposed to be, the guardians of safety for healthcare workers, they didn't seem to have a firm grasp of this concept.
Wait, really?
In fact, he quotes the former chair of the IPC Cell as saying that they had no experience with the hierarchy of controls.
They had no experience with this basic safety concept.
It's a pretty shocking admission when you think about it.
And they're in charge of safety during a pandemic.
Right, and it raises all sorts of questions about, how decisions were being made,
And what those decisions were based on.
Yeah.
And if those decisions put healthcare workers at risk.
Exactly.
I mean, this is just, it's mind-boggling. So where do we go from here? Like, what are the takeaways? What needs to change to make sure something like this never happens again?
Well, Osborn is a huge proponent of accountability.
Okay.
He really believes there needs to be a thorough examination of what happened.
Yeah.
Not to, point fingers or assign blame, but to actually learn from these mistakes.
Right, because it feels like this could easily happen again.
Exactly, especially with,
the next pandemic.
The next pandemic, potentially right around the corner. We need to be better prepared. And that means understanding the virus, obviously, but it also means having the right systems in place to actually protect people.
To protect the people protecting us, right?
Exactly.
Yeah.
Exactly. And one of the things that Osborn keeps coming back to is transparency. He thinks those minutes from the IPC Cell meetings, those should be made public.
Oh, interesting.
So we can actually see how those decisions were made, who was consulted, what evidence they were using.
It's about rebuilding trust, in a way.
Absolutely. Absolutely. Because remember, these decisions, they had life or death consequences for both healthcare workers and patients.
Yeah. And I think it's easy to say, well, they were acting in good faith. They were doing the best they could with the information they had at the time. But Osborn makes the point that good faith isn't really enough.
Especially when the stakes are this high.
When the stakes are this high, yeah. It's one thing if I accidentally wear mismatched socks.
Right.
It's quite another thing if people are dying because of, oversights and lack of expertise.
Exactly.
So, yeah, this deep dive was focused on what happened in the UK, but it really makes you wonder, how did your country handle this? How did they approach risk assessment during COVID? Were the right voices in the room?
Were healthcare workers adequately protected?
These are all really important questions.
Mm.
And we should be asking these questions.
Absolutely. We need to learn from this.
Yeah. We need to learn from this so we can do better next time. All right, everyone. That's it for our deep dive today. As always, we've got some additional resources in the show notes if you want to go even deeper on this. Until next time, stay curious.